Now, Elizabeth, we both know that we both ran it, and all the money went back to stroke services throughout the community. How did you feel that day?
Well, I felt fantastic, but I have to correct you. I did not run. I walked it.
But you completed it.
I completed it. That was very important for me. And that was a big step. And I remember the first year that they had the Downtown Dash, I couldn't do it. So I promised myself the next year and the years after, every year I'd participate. And I was there. And I think I had a different feeling than other participants. I was just feeling every single step that I was taking. So I was very happy to be able to walk and be there alive and well with all my friends and community members. So it was a fantastic feeling.
And again, I love doing it with you because we were there running throughout the whole thing together.
Yeah.
I had an opportunity, as did Gregory, to talk to some other people who participated in the Downtown Dash who had survived stroke, including one gentleman who was walking the course, but he was doing it exactly 1 year to the day after having suffered his stroke.
Wow.
I felt a great deal of happiness and pride for him and his accomplishments. So let's go back to what happened to you. Technically, what you suffered initially is called a TIA, transient ischemic attack.
That came later, I think. That came after my carotid dissection that happened. The next day that I was admitted, I underwent a surgery called a cerebral angiogram. And that kind of, I guess, determined for the doctors where I'm at in terms of my hemorrhage that was going on in my brain. But at that time, there were several doctors that were treating me. They weren't sure what was really wrong with me. And they decided to medicate and treat me on medicine. And after 4 or 5 days, I was feeling a little better. The pain had subsided quite a bit. And they decided, well, they'll transfer me to NTU, which is the neurotelemetry unit, which is a lesser degree of intensity than SICU. But I think after a day in the NTU, the next day, when I woke up at 5 o'clock to call the nurse, I wasn't able to move my hand. I wasn't able to talk.
Not a good sign.
Not a good sign. And my heart was beating so fast, I was like, okay, I can't talk. This is not right for me. I mean, this is just not, what, and all kinds of thoughts went in my mind. It's like, what if I will never be able to talk? What if I will never be able to move my right hand or right leg, or I couldn't at the time. So I reached for, with my left hand to that, the buzzer to the nurse, and I called them. And from the reaction, I knew I was having the TIA, which is the transient ischemic attack, which is a short stroke, which I think Dr. Rappard will explain to you. But so it was just a very different feeling, very, I don't know, I've never experienced that kind of a feeling to not be able to move or talk. And after that, that night, I was operated on, and there were some stents put on my left carotid artery to stop the bleeding. And then my whole process of treatment began with all the neurologists and neurointerventionists, and just as a team, they started working on me. And I remember just, you will see Dr. Rappard. I remember him working so hard, and the team were there, and they were all trying to come up with a solution and how to treat me and how to make me well. And that was just really, really very, I just felt so well taken care of at the Adventist and the stroke center with the doctors. So,
Were you conscious throughout all of this?
Yes, I was pretty conscious. I had, I had some issues with losing blood and hemorrhages and a lot of other issues. I think my problem was not just one. It just kind of, I don't want to go into the detail, but it's exasperated as time went by. I had hemorrhage, I had blood loss, and they didn't know what kind of a medicine the doctor should administer at first. So there were a lot of issues that had to work together to make me well. And and on top of that, I had family members that were like really concerned, and my husband was by my side, and just it was a lot of it was a very different time in my life. Let me just put it this way.
Well, your older son was traveling, and when
He
your
was in
husband,
Australia, yes. He
yeah,
was in
when
Australia at the time.
when he told him,
Yes.
Mom's had this, this
Right,
attack, and she's
right,
in the hospital.
right.
He came to your bedside with
He-
eyes as big as saucers.
Right. He just, I would never forget the look on his face and the care. It's like, Mom, what happened to you? Are you well? And I just saw the concern in a 18-year-old's face. It was just, I knew, he cared, and my younger son too, and my husband, just phenomenal. I mean, I think he's a world of him. I think that really it made our relationship closer that way. I felt how much he cares. And the fact that he was able to stay at the hospital by my bedside. He didn't leave my bedside 24/7. So that's, I fell in love with him all over again.
You were saying earlier that you actually do things.
Yeah, I just...
Where the tissues? Well, because, you said that during the Downtown Dash, you experienced every step.
Yes.
And now you're saying that you fell in love with your husband that you've been married to? How many
23 years.
All over
24,
again in a whole
yes.
different way.
In a whole different way. In a whole different way.
What do you think it exactly was that made you look at each step differently, love your husband a different way?
Well, when an incident like this happened, you kind of tend to reevaluate your life. And the fact that I was there very close to not making it, dying, gives you a different perspective. You have a different perspective, your loved ones. And there would not a day go by, because after the incident, after coming home, I had to undergo treatment and also go to different, facilities for treatment. Every day I'd get a call from friends, from relatives. They would be there with, with all kinds of well wishes and prayers and everything. So it just makes someone's life richer when they go through an experience like this. With people who are involved, you look at things differently. So that really made it a very special time in my life. So.
You got it.
Yeah, I got it. I
Because
got what life was all about.
It was like a God shot.
Yeah, and
okay.
At that time I had no regrets too. When you go back to your life at that last moment that it's time for you to go, you say, what is it that I wanted to have done that I didn't do? That moment came to me, and I had no regrets. I'd resolved all the issues with whoever I had to resolve, and loved whoever I had to love, and that's a great feeling, I think, don't you think?
I aspire to have that feeling.
And so.
When we come back, we will continue talking with Elizabeth. We will also introduce you to the doctor whose dramatic intervention saved her life. Don't go away.